Before I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available to me.
Well, that's easy to do, is it not? Is it hard to manufacture?
It is easy to do for some countries. What happened in the United States is that the CDC created a test,
up a reagent,
sent a test out to 50 states, and then said, oh, hold up, don't use it, let us fix it.
How quickly
it's
can
now
we get
March.
on track now, Matt?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case, plead to test people. This is not good. We know that there are 88 cases in the United States. There are going to be hundreds by middle of the week. There's going to be thousands by next week.
That is just gross ineptitude that is costing Americans lives by the day. It's really remarkable, Mika. Unbelievable.
That was New York City infectious disease physician Matt McCarthy telling CNBC that hospitals have a shortage of diagnostic tests, which has left them unprepared to take on the coronavirus. Joining us now, Morning Joe medical contributor Dr. Dave Campbell. Dr. Dave, thanks for being on. What do we know about when testing will get everywhere, or is this an issue where some localities may not get tests and there'll be many cases out there?
Well, Mika, we already know that there are many cases out there, and the numbers that you hear every single day increase. 15 states, over 100 cases, 6 deaths as of now. And if you don't have a test kit or a testing ability or the ability to get this to the public health center locally, you can't get a positive test. If you look at the map of the United States and see state by state being added to the list of states with positive findings, it's growing. It's rather like a wildfire. You see state after state that are attached to each other. So when will we get more test kits? It's a work in progress.
Hey, Dr. Dave, it's Willie. We heard the frustration in the voice of that physician here in New York City yesterday. The best you can understand, why aren't these tests made available? As he said, it's pretty easy to do in other countries. It should be easy to do here. Why don't these hospitals have the testing kits they need?
Willie, there's a few reasons, and part of it is that there have been some regulatory hurdles that have been put in place. As those get lifted, as particularly with Dr. Fauci now yesterday saying that we have community spread. He said yesterday that we have a likely pandemic. And when Dr. Fauci with the NIH is concerned that within the next few weeks that we will be seeing increasing community spread, that becomes the definition for pandemic when it is global. We have that now.
Dr. Dave, I spoke yesterday with an expert in the field who told me he would not be surprised within the next month if you started seeing school closings for 2 weeks, 3 weeks. Would not be surprised if you saw theaters shut down. Would not be surprised if you saw just the way we live altered greatly. And he talked about China and how China moved so rapidly. In a way, this democratic country could never move, but how China moved rapidly, how Japan's moved rapidly, and how when that happens, when a society moves quickly, that actually there can be at least a slowdown of the spread of this potential pandemic.
Joe, look at China. China has finally seen a slowing down of the spread when you look back in January and see the numbers then. So that is encouraging. That's perhaps the only encouraging news I can give you today, that China may be turning the corner. But China and the entire world, look at the entire world. We have, compare where we are now with the influenza virus that affects 1 billion people a year. And every year, seasonal flu kills somewhere between 290,000 and 650,000. We only have a few thousand deaths so far with the COVID-19 disease that comes from this novel coronavirus. But as the numbers increase, we will be seeing that gap between seasonal flu deaths and COVID-19 coronavirus deaths start to narrow. So we should, a couple weeks ago we spoke about this and we were fearful for community spread, fearful and prepared to do things when we need to. school closures, as you said. It's now time to do these things.
Dr. Dave, just big picture here, how should people be thinking about this? There are a lot of parents watching right now, a lot of families watching who see all these headlines and they say, okay, I have the information. What am I supposed to do about it right now? There's a grocery store here in New York City last night. I can tell you the line was 45 minutes long because people are snatching up all the food and the bottled water and preparing for the worst. How should Americans watching right now be thinking about coronavirus?
You know, I'm here in Florida. When a hurricane is coming, you go to Home Depot and you go to the store and you stock up. When the first feeder bands start to hit, you know you wished you had gone to Home Depot the week before. The feeder bands are here. So we needed to start preparing last week by stockpiling whatever you need for your home in case you can't get out or don't want to get out, or the schools close, trips are being canceled. Lots of my friends and colleagues that had trips or meetings to go to have canceled those. So this is the week not to become overly excited, to become very focused, become very prepared, and prepare your workplace, prepare for your kids to be home, prepare to work from home if need be, if we're told to do that. We aren't being told that yet, but this is the first week that I would say you really have to prepare right now for those possibilities.
All right, Dr. Dave Campbell, thank you very much. We'll be having you back for sure to talk more about this ongoing story.